Hi, my name is Meabh Smith. I'm presenting from Dublin, Ireland on the development of a set of minimum requirements for remote patient monitoring solutions. So the team that worked on this came from many different areas, different organizations, and working at different levels. So, and this was a national solution. So we had a chief nursing information officer, two clinical engineers, myself and Michael Dwan, and Heather Cronin, who is a health and social care professional lead in Ireland. And I think that was key that there were different professionals working across different organizations. So what did we want to do? Well, we wanted, with regard to digital health technology, to protect the investment, to ensure that any investment resulted in clinically valid solutions that were technically safe and that worked with the workflows that we had. The context was that there were changing models of care due to COVID, as I think all of us have lived through now. And in Ireland, we were rapidly deploying new digital technology. And there are many startups in that space in Ireland. So we found ourselves offered many new solutions. And how were we going to know that investment was safe and that our patients were safe? So what we needed was some sort of a health technology assessment tool, but we needed to be able to rapidly deploy it. It needed to be very tailored for digital solutions, and it also needed to be something that could be localized, so that was suitable to different organizations, because what's suitable for my hospital mightn't be suitable for a community level or for another hospital. And when we look back on this process, we found that essentially our process followed Cotter's 8 steps to change. So there was urgency created by COVID. There was a powerful coalition working on this solution and other aspects of the implementation of digital healthcare. We had a vision for change, which we were able to communicate. We were part of a larger telehealth movement in the health system in Ireland, which really worked hard to remove obstacles. And we had some very quick wins with digital solutions that made a real difference in our hospitals and to our patients. And now we're at the stage of very much building on that change and anchoring the changes in corporate structure, which is not an easy thing to do. So the goal of our work was to develop a tool that was suitable for rapid assessment of digital technology. We needed something that was easy to use, that was standardized, relevant, effective, that was sensitive to different organizational structures, and that also accounted for people, process, and technology. The potential beneficiaries of this are the funders, obviously getting value for money and not bringing risk upon themselves, clinicians who were able to continue to provide care in a very difficult environment, and patients who were able to receive home-based care, and in fact very tailored care, and also for clinical engineers who for whom it was very important that there was an appropriate investment in effort as well, because as this audience is very well aware, the clinical engineers had many things happening, and it was very important that we used our time very carefully. But we would also be very interested in sharing this work with the international community and hopefully developing it up further, because it's very much collaborative work. So what we did was along the left-hand column there, you can see that we focused on different themes that we wanted to break further down into deeper and deeper questions. So for example, looking at all the questions about the data journey and data safety, data security, looking at all the costs, upfront costs, hidden costs, even transport costs for devices, and interoperability, including things like integrating with the patient record, even if that's a paper patient record. How can you manage that? So we needed to define lots of other things. Did our questions have subjective or objective answers? What assessment standard were we using? Did these questions relate to process or workflow, the impact of the technology? Were solutions effective and relevant? What about safety, cost, usability. All those things were broken down, and we wanted to make sure that we asked sufficient questions on each one of them. So what we ended up with was essentially an Excel spreadsheet of approximately 140 questions. And this is just a screenshot of the deployment of the tool for 3 separate solutions. And the way that we set it up was that blue answers are factual answers. Green answers are something that we're satisfied with. Red means we're unsatisfied, and if there is a red in the responses, then this solution really can't go forward unless there are mitigations or actions taken to make that an orange. So, for example, that question number 84, if the technology readiness level is less than 8, then the device needs to be stress tested. And there needs to be much more oversight than if it's, for example, a technology readiness level of 9, where it's been already widely used. So this is essentially the tool, I've told you the story of how we've gotten to that stage. Some sort of tool for assessment of rapid digital technology, for rapid assessment of technology is necessary to ensure that there's valid, cost-effective and safe use of technology in our health systems. But using a system such as we've developed here really supports innovation, because it provides transparency to people developing these solutions and marketing them, so that they know what we need to see in the products that they're selling. It also contributes to business case development and the development of specifications for solutions, because by the time you answer all these questions, by the time you assess all these questions for a new solution, you will be very clear about what you want. And risk assessment is required as part of the tool, and that should be required in any case for bringing in any new solution or any new way of delivering healthcare. But one of the big learnings that we had was that that true value from a tool such as this can only be achieved when there's buy-in from senior decision makers and practitioners. Because a solution such as this, it's just a tool, and unless it's embedded within governance structures within any organization, it really doesn't have a future, because there's no authority around it. So that's our big thing. And we would be very interested in any approaches from anyone who wants to work with us on further development of this. Thank you.